Hi, everyone. Robert Burroughs here, Chief Growth Officer at AAMI, and I am here with Dr. Michelle Tarver, the Director of the Center for Devices and Radiological Health at the Food and Drug Administration. And Dr. Tarver, thank you so much for joining me.
Well, thank you for having me.
And I want to thank you also for joining us last week at AAMI neXus. We had a packed house for your keynote, and everyone was excited to hear from you exactly what the priorities are that you guys are looking at over the coming year. And I really appreciate you participating in all of that Q&A. You were a trooper to hang in there with all that.
It's always a pleasure to hear it. Its enthusiasm and the excitement from the audience is always a pleasure to be able to hear.
Well, that is certainly there, and it was an extensive keynote, an extensive Q&A, but I wanted to ask you if we could cover a few of the things that were most important to pull out or to focus on in the few minutes we have together and share that with folks that weren't able to be at AAMI Nexus. So I want to start, if you will, with standards. You've always been a big supporter of voluntary consensus standards and the role that they play in the work that you do at CDRH. Can you say a bit about why standards are so important to you and how you think they support patient health?
Well, standards are critically important because they ensure some predictability and consistency from submission to submission when they come into the House, but not only within the US FDA review process, but also across the globe, so that other jurisdictions can also have that same quality of evidence in informing their regulatory decisions. I think that process of working together, bringing great scientific minds to the table, working out some of the technical difficulties, implementing a practical approach to how one generates the evidence that can inform device development, device evaluation. That's really how we move the needle forward and ensure that innovation get to the hands of the patients that need it most in a timely manner. I think the other really important things about standards is that the effort to develop them is a shared experience so that one particular entity doesn't have to come up with methodology on their own. It really allows us to do that in a very collaborative way that helps to improve healthcare outcomes and the medical device development industry.
I think that's one of the things that is always surprising to folks when they first get involved in the development of standards is you are in the room with FDA and other regulators. You're in the room with your peers, fellow scientists, developers, manufacturers. And I often hear from them that the benefits of that process exceed even what they expected in terms of the outcome and actual standards document. So say a little bit about that. You guys participate extensively, not only with AAMI, but across a number of organizations as well.
Yeah, I mean, I think your point about the importance of developing relationships can't be stated enough. I mean, developing relationships allow us to have those difficult, tough conversations, to ask really probing questions of one another, but it's in an environment of trust so that you truly can develop solutions that work well. I mean, we also have initiatives such as collaborative communities where folks work on particular topics, whether it be pathology innovation, whether it's ophthalmic innovation, if it's wound care. There's a lot of different areas that we work with collaborative communities, and those are grassroots efforts. They aren't efforts that the FDA starts, but it's topical areas where the community has recognized here's a challenge. It's not going to be solved very quickly in a task force or a very time-limited approach, but it's going to require sustained engagement with folks across the stakeholder, including patients and providers and payers and industry and regulators and others who need to kind of come together to form solutions, not only that are going to work for the regulator, but may also work in terms of helping that particular medical device be implemented into clinical care, be deemed acceptable to patients, be paid for, and also have a cycle that continues to iterate and potentially collect evidence to understand how it continues to perform once it is deployed. So all of that can take place in many different venues, but I think critical to that solution generation is the partnership, the relationships.
Absolutely. And actually, that echoes something that I heard time and time again from your staff that were at AAMI Nexus. And I like the phrase you used, sustained engagement. That's what we're trying to do with AAMI Nexus and all of the communities that we serve. But to echo what I heard from your staff, they want to have conversations with folks. And I've always been struck by how open and collaborative folks in CDRH are in session after session as folks were getting the opportunity to ask questions after a presentation or a panel. Your folks were stressing, pick up the phone and call us. reach out to us, not just at the moment of submission, but throughout your process. We want to engage, we want to hear from you. And they also encourage folks to get involved in standards development, collaborative communities, et cetera. But for folks listening out there, if you haven't interacted heavily with CDRH in the past, I want to be their spokesperson on this front. Engage them early and often. And what you're going to find is an agency that's really focused on mission, really focused on the outcome of patient health, promoting and supporting patient health. And yeah, it's an incredibly refreshing thing to see from a regulator with oversight capacity. And your folks would even say, sometimes I know we seem scary, but we're really not. We're here to help and we're here to serve the patients. So I hope people will take advantage of that and get engaged in all of these venues where you guys show up to be available to folks. So
I think it's a really important point, though, that you mentioned, which is, come talk to us, but come talk to us with a very clear question so that
mm,
we give you a very clear answer. And I encourage people to come talk to us before they've already developed all their evidence, because by then it may be too late. It's good to check in when you're not sure, where there's not a precedent that's available someplace externally. We've talked about standards. We recognize standards, and so we have a listing of all the standards we recognize. You don't need to come talk to us about those. But if there's some place where you're not quite sure, there's nothing out there, either on our website or available on adjacent websites, that's when you might want to come ask us a very targeted question, because that can help streamline your development and make sure that you're generating the evidence you actually need to inform our regulatory decision, not evidence that may be ancillary and not as helpful.
right, right. And so I don't blow up your phones. I don't know if I have the power to even do so, but I'll say if folks have a question about existing standards, the process, training around those standards, et cetera, reach out to AAMI. That's what we're here for. We're the source of many of these standards, and we can support that. But as Dr. Tarver just laid out, if it's beyond the scope of what's currently defined and known, or there are questions that other folks can't answer, that's a great time to reach out to FDA. And I especially like what you said about the benefits of reaching out early so that there's not rework in an era when there's so much innovation going on, whether it's around large language models or agentic AI or any version of AI that people want to discuss, all the other digital tools. There's a lot of innovators out there who haven't been through this process before. And you can get pretty far down the path and find out there was something you should have been doing along the way that's going to set you back. And so I hope folks will listen to you and seek out that information as they go, rather than getting to a moment where they say, and now it's time to go through the regulatory process. That is not the way to think about this. And so hopefully they'll reach out to us or you as appropriate. So I know we only have a few more minutes together, so I would like to touch on what I think is one of your top initiatives at CDRH, and that's home as a healthcare hub. So let me ask you first, how did this come to be one of your top priorities at CDRH?
Yeah, I mean, I think this was really very much born out of our experience dealing with COVID-19 and the challenges we all faced when everything shuttered its doors and people were sick and there was no way to figure out how they were doing at home. It showed that we needed to have more agile technology that could help assess people and how well they were doing while living their daily lives, as well as facilitate that transfer of information into the traditional healthcare setting. On the tail end of that public health challenge, we also started to see that hospitals were closing in certain zip codes. Clinicians were leaving and getting burnt out from clinical care, and we were not replacing those physicians at the same rate. And at the same time, the chronic disease rates in our population continue to climb, both in the adult and the pediatric population. It really is a crisis that we have got to use technology and medical devices to help us navigate. And so this initiative was born out of recognition of that reality and what the future will look like so that we can be better prepared to deal with it. And so this initiative is really one, it's very person-centered. It's ensuring that we develop with the person in mind, the patient in mind, so that we're not developing solutions in the clinic and just trying to force them into someone's home. That we're
Mm,
thinking about how does that function translate into a home setting in a way that it's seamless, that it's not intrusive, that it maintains the person's dignity, but also encourages them to engage with it so it can actually improve their healthcare outcomes. So that's one of the efforts that we've launched. Another effort under this same umbrella is the importance of data flow and data
mm,
portability, because if devices don't work with each other, and the information collected in those devices don't communicate with the healthcare provider systems, you get siloed systems that do not actually translate into improved healthcare outcomes. So we're working on efforts around interoperability too. And there's a lot of standards happening in that space. So we're very
Absolutely.
actively engaged there. And then I think the third component is the ways in which digital health technologies that are actually in the home, are they reimbursed? Are they covered? What's the evidence that supports that? And so we're having conversations with developers about how one collects the important data that's going to inform the payers' decisions. Because if it's not paid for, then it won't be used, and then it loses the possibility to
Right.
actually improve healthcare outcomes. So those are the three different prongs that we're very much focused on in this effort, and we've made a lot of headway both with our Tempo pilot program, which is tackling the reimbursement and the evidence generation in the process of collecting information and reimbursement, as well as some of the person-centered development. There's an innovation challenge that we recently launched called the Ready Challenge. It's about focused on readmission rates and ways in which we can decrease readmission rates following a hospitalization. About 10 to 30% of people are readmitted in the first 30 days after they're discharged from a hospital. Results in significant morbidity and mortality, and it's associated with a very high price point of about $20 billion. So a lot of money is going here. If we can innovate and have medical devices that help people safely transition from hospital to home and stay home and healthily heal, I think that is a huge win for not only that patient, but for all of society. And so we have a challenge out, hoping that companies will raise their hands and saying, I have a solution to help in this space. We're going to give you sprint discussions, a lot of FDA interactions to help move it forward towards a timely regulatory decision. So those are some of the two big pilots, initiatives, challenges that we have underway, and we're going to be looking to do other things to help move the needle so that healthcare can be successfully realized in the home.
Yeah, it's fantastic. It's one of those few things where you sort of do good on all fronts for all stakeholders. This was born out of, somewhat not born out of, but driven by necessity, as you mentioned during the pandemic. But we've known for a while, and you know far better than I as a practicing clinician, folks are healthier at home if they can be there. There's a reason to be in an acute care setting, but if you can get the care that you need at home, you have better outcomes. So it's good for the patient. It's good for the family. You can be with your loved one. You can support your loved one in a way that's very challenging in an acute care setting. And it's good for our healthcare system because it's actually more effective, more efficient. And I think that, as you said, as we develop the real world evidence to support all of these transitions into the home of different areas of specialty and support, our payers are going to see this is actually better for them as well. And so it's a rare opportunity, and the moment in time is right because of all the new technology that's coming along to enable this. We could not have done this 20 years ago in the same way or maybe even a year ago. I've started like not knowing how to track time with the pace of change, but it's all possible now. And folks, you heard it from Dr. Tarver. These pilot programs or these challenge programs are out there. You can go to the FDA website, hit the healthcare or home as a healthcare hub part of the site and learn about these programs and get engaged. And you're going to get a lot more support, which will accelerate your development activities, et cetera, et cetera. So once again, kind of a win-win for everyone. So Dr. Tarver, I know we're almost out of time. You're one of the busiest people in the world doing what you do at CDRH, and also still, as I mentioned, a practicing clinician helping patients. And so in the last moments we have here, anything else that you would like to cover, or I haven't been smart enough to ask?
I will say this. I think the important thing that we should always keep in mind is that patients are our priority. All of the work that we do should be focused on helping to improve their health and well-being. And if we are aligned on that, we will make a significant difference in moving the needle in terms of public health. We are happy to partner towards that initiative. And I encourage folks that if they have a great idea, something they think the agency should focus on, ring our bell, let us know. We are open to new approaches, innovative solutions, not just in terms of the technologies we regulate, but also approaches we may take in order to help meet our public health mission. And so we're very grateful for organizations that are also committed to helping to improve the quality of science, the quality of data by moving forward standardization efforts, as well as those who are committed to looking at things differently and being willing to partner in that process.
Fantastic. Well, I can't add anything to that other than my thanks. Thank you for joining us at AAMI Nexus, and thank you for taking the time to share a little bit with folks who weren't able to be there. And we just look forward to supporting you and all of CDRH in the coming year.
It was my honor, and thank you all very much.
Thank you.